Hello and welcome to AI Mental Health Care, your space for understanding the mind and empowering your well-being. I'm your host, Teodor. Have you ever felt a persistent wave of sadness you just couldn't shake? Or a knot of worry in your stomach that never seemed to unwind? You're not alone. Millions of people experience these feelings every day. In fact, according to the World Health Organization, depression and anxiety are among the leading causes of disability worldwide. But what exactly are they? And how do you know if what you're feeling is a fleeting bad mood or something more significant? Today, we're shining a light on two of the most common mental health conditions, depression and anxiety. We'll explore their symptoms, understand their impact, and most importantly, talk about how to navigate these challenges. Stay with us as we demystify these conditions and offer a message of hope. Before we dive into the specifics of depression and anxiety, it's important to acknowledge that our emotional landscape is vast and varied. It's perfectly normal to feel sad, worried, or stressed from time to time. These emotions are natural responses to life's challenges. A tough day at work, an argument with a loved one, or facing a big decision. Think of it like the weather. Some days are sunny, others are cloudy, and occasionally we experience storms. The key difference between everyday emotional fluctuations and a mental health condition like depression or anxiety lies in the intensity, duration, and impact of these feelings on our daily lives. When the clouds don't seem to part for weeks or months, when the storm feels relentless and overwhelming, and when it starts to interfere with your ability to work, socialize, or simply enjoy life, that's when we might be looking at something more than just a bad day. It's also crucial to remember that mental health exists on a spectrum. You don't have to be in a state of crisis to pay attention to your emotional well-being. Just like with our physical health, early awareness and understanding can make a world of difference. So, let's start by exploring depression. When people hear the word depression, the first thing that often comes to mind is sadness. And while persistent sadness is indeed a core symptom, depression is a much more complex and multifaceted condition. It's an illness that can affect how you feel, think, and behave, leading to a variety of emotional and physical problems. Imagine carrying a heavy backpack, one that you can't take off. Day by day, it gets a little heavier. At first you manage, but over time, even simple tasks feel exhausting. That's what living with depression can feel like for many. Let's break down some of the common symptoms. According to diagnostic guidelines like the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, for a diagnosis of major depressive disorder, someone would typically experience 5 or more of these symptoms for at least a 2-week period, representing a change from previous functioning. And importantly, at least one of the symptoms must be either a depressed mood or a loss of interest or pleasure. Persistent depressed mood. This isn't just feeling blue occasionally. It's a near-constant feeling of sadness, emptiness, or hopelessness, most of the day, nearly every day. For some, especially children or adolescents, this might present as irritability. Think of Sarah, a vibrant young artist who suddenly found her world turning grey. The colours she loved to paint felt dull, and a general sense of gloom followed her everywhere, regardless of what was happening around her. Loss of interest or pleasure, anhedonia. This is a big one. Activities that once brought joy, hobbies, spending time with friends, even things like eating or sex, now feel uninteresting or unappealing. Imagine Mark, who used to live for his weekly football game with friends. Suddenly, he's making excuses to skip, not because he's busy, but because the thought of playing just feels blah. The spark is gone. Significant weight loss or gain, or decrease or increase in appetite. Depression can profoundly impact appetite. Some people lose all interest in food and lose weight without trying, while others might find themselves overeating, often seeking comfort in food, leading to weight gain. Insomnia or hypersomnia. Sleep disturbances are very common. This could mean difficulty falling asleep, staying asleep, insomnia, or conversely, sleeping too much, hypersomnia, yet still feeling unrefreshed. Picture Lisa, who stares at the ceiling for hours each night, her mind racing, only to feel exhausted when the alarm clock rings. Or Tom, who can barely drag himself out of bed after 10-12 hours of sleep, feeling like he's moving through molasses. Psychomotor agitation or retardation. This refers to observable changes in movement. Agitation might look like restlessness, pacing, or an inability to sit still. Retardation involves slowed thinking, speaking, and body movements. It might feel like your thoughts are wading through treacle or your limbs are heavy. Fatigue or loss of energy. This is more than just typical tiredness. It's a profound lack of energy that isn't relieved by rest. Everyday tasks can feel like climbing a mountain. Even getting out of bed can feel like a monumental effort. Feelings of worthlessness or excessive or inappropriate guilt. People with depression often experience intense feelings of worthlessness or ruminate on past perceived failures, blaming themselves for things that are not their fault or are out of their control. It's a harsh inner critic working overtime. Diminished ability to think or concentrate, or indecisiveness. Making decisions, even small ones like what to have for breakfast, can feel overwhelming. Concentration can be severely impaired, making it difficult to read, watch TV, or follow conversations. Recurrent thoughts of death or suicidal ideation. This is the most serious symptom and requires immediate attention. These thoughts can range from a passive wish to not wake up, to active plans for ending one's life. If you or someone you know is experiencing this, please reach out for help immediately. We'll provide resources at the end of this episode. It's important to remember that not everyone with depression will experience all of these symptoms, and the severity can vary greatly. Someone might be high functioning, going to work and meeting responsibilities, but internally they are struggling immensely. This is sometimes referred to as smiling depression. The outer appearance doesn't always match the inner turmoil. The key takeaway here is that depression is a real and treatable illness. It's not a sign of weakness or something you can just snap out of. Understanding these symptoms is the first step towards recognizing it, either in yourself or in someone you care about. Now, let's shift our focus to anxiety. Just like sadness, worry is a normal human emotion. It's our brain's natural alarm system, designed to alert us to potential danger and help us prepare for challenges. A little bit of anxiety before a presentation or a big exam can even be motivating. But what happens when that alarm system becomes overly sensitive? What if it starts going off constantly, even when there's no real threat, or disproportionately to the actual situation? That's when everyday worry can cross the line into an anxiety disorder. Anxiety disorders are characterized by persistent, excessive fear or worry that is intense enough to interfere with daily activities. The feelings are often accompanied by physical symptoms. Unlike the more generalized low mood of depression, anxiety often manifests as a feeling of dread, apprehension, or an overwhelming sense of nervousness. There are several types of anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias, each with its unique nuances, but they share common threads of excessive fear and worry. Let's look at some general symptoms you might encounter. Excessive worry. This is the hallmark of generalized anxiety disorder. It's not just worrying about one specific thing. It's often a cascade of worries about various aspects of life: health, finances, work, family, and it's difficult to control. Imagine David, who spends hours each day replaying worst-case scenarios in his head, even when things are going relatively well. He knows his worries are probably overblown, but he can't stop the what-if cycle. Feeling agitated, restless, or on edge. There's a constant sense of unease, like something bad is about to happen. It can be hard to relax or sit still. Think of it like a motor that's always running, even when you want to switch it off. Fatigue. Surprisingly, even though anxiety can make you feel revved up, it can also be incredibly draining. Constant worrying and heightened alertness are exhausting, leading to a sense of being mentally and physically tired. Difficulty concentrating. Similar to depression, anxiety can make it hard to focus. Your mind might feel like it's racing, jumping from one worry to another, making it difficult to pay attention to tasks or conversations. Irritability. When you're constantly on edge and overwhelmed by worry, your fuse can be shorter. Small annoyances that you might normally brush off can trigger a disproportionate irritable response. Muscle tension. Anxiety often manifests physically as tense muscles, particularly in the neck, shoulders, and back. You might find yourself clenching your jaw or balling your fists without even realizing it. Sleep disturbances. Trouble falling asleep or staying asleep is very common with anxiety. Worries tend to surface when the distractions of the day fade, making it hard to switch off and rest. Panic attacks, especially in panic disorder. These are sudden, intense episodes of fear that trigger severe physical reactions when there is no real danger or apparent cause. Symptoms of a panic attack can include a racing heart, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, chills, or heat sensations, and a fear of losing control or dying. They can be incredibly frightening, often making people worry about having more attacks. Maria, for instance, had her first panic attack in a crowded supermarket. Now, the fear of having another one makes her avoid public places, significantly impacting her life. Avoidance, often seen in social anxiety and phobias. People with anxiety disorders may start to avoid situations, places, or people that trigger their anxiety. While this might provide temporary relief, it can reinforce the anxiety in the long run and shrink their world. Just like with depression, the intensity and combination of these symptoms can vary from person to person. And it's possible to experience anxiety without meeting the full criteria for a disorder, but still find it significantly impacting your quality of life. Recognizing these signs is the first step towards finding strategies to manage that overactive alarm system. Now that we've explored the symptoms of depression and anxiety separately, you might have noticed something interesting. Some of the symptoms overlap. Difficulty concentrating, sleep disturbances, fatigue, and even irritability can be common to both conditions. This overlap is one reason why it can sometimes be tricky to distinguish between them, and also why they frequently occur together. It's very common for someone with depression to also experience anxiety and vice versa. This is known as comorbidity. Think of it like two sides of the same coin, or perhaps two distinct weather patterns that can unfortunately occur at the same time, creating an even more challenging internal storm. However, there are also key differences. Core emotion. The dominant emotion in depression is typically persistent sadness, hopelessness, or a loss of interest. In anxiety, the core emotion is fear, worry, and apprehension about future events or perceived threats. Energy levels. While both can cause fatigue, depression often involves a profound lack of motivation and energy, a feeling of being slowed down, psychomotor retardation. Anxiety, on the other hand, can often involve a sense of restlessness, being keyed up or agitated, even if it's also exhausting. Focus of thoughts. With depression, thoughts often center on past regrets, feelings of worthlessness, and a bleak outlook on the future. With anxiety, thoughts are more often focused on future worries, potential threats, and what-if scenarios. A person with depression might think, "I'm a failure, and things will never get better." A person with anxiety might think, "What if I fail this presentation and lose my job?" Motivation versus avoidance. In depression, the lack of motivation often leads to withdrawal and inactivity because things feel pointless or too effortful. In anxiety, avoidance is often driven by a desire to escape the distressing feelings of fear or panic associated with certain situations. Let me share a simple analogy. Imagine you're supposed to attend a party. Someone with predominant depression might not go because they feel too sad, exhausted, and believe no one would want them there anyway. What's the point? Someone with predominant social anxiety might not go because they're terrified of being judged, saying the wrong thing, or having a panic attack. What if I embarrass myself? Both result in not attending the party, but the underlying reasons and emotional drivers are different. Understanding these distinctions, as well as the common co-occurrence, is vital for getting the right kind of support and treatment. If you're experiencing symptoms of either or both, a healthcare professional can help to provide a clear diagnosis. Knowledge is power, especially when it comes to our mental health. Now that we've explored the symptoms of depression and anxiety, let's talk about what you can do with this information. 1. Self-awareness and self-monitoring. Tune in. Pay attention to your feelings, thoughts, and behaviors. Are you noticing persistent changes? Are these changes impacting your daily life? Journaling. Sometimes writing down your experiences can help you identify patterns or triggers. Note how you're feeling, what you're thinking, how you slept, and what your energy levels are like. Over time, this can provide valuable insights. Don't judge, just observe. Try to approach this self-reflection with curiosity rather than judgment. The goal is understanding, not self-criticism. 2. Recognizing symptoms in others. Observe changes. If you notice a friend, family member, or colleague exhibiting significant changes in their mood, behavior, sleep patterns, or social interactions, it might be a sign they are struggling. Are they withdrawing more? Seem more irritable or sad? Talking about feeling hopeless? Listen, actively and empathetically. If someone opens up to you, listen without judgment. Validate their feelings. Phrases like, "That sounds really tough," or "I'm here for you," can make a huge difference. Encourage gently. You can gently encourage them to seek professional support if you're concerned. You might say, "I've noticed you haven't been yourself lately, and I'm worried about you. Have you considered talking to someone about how you're feeling?" 3. When and how to seek professional help. The when. If symptoms are persistent, lasting more than a couple of weeks, significantly distressing, or interfering with your daily functioning, work, school, relationships, self-care, it's time to seek help. If you're having thoughts of harming yourself, please seek help immediately. The WHO, your general practitioner, GP, or primary care physician. They are often a great first point of contact. They can assess your symptoms, rule out any underlying physical causes, and provide referrals to mental health specialists. Psychiatrists. medical doctors who specialize in diagnosing and treating mental health conditions. They can prescribe medication if needed. Psychologists and therapists, counselors, social workers. These professionals provide psychotherapy, talk therapy, and can teach coping strategies. Different types of therapy, like cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, have been proven very effective for depression and anxiety. Helplines and crisis lines. These are invaluable resources for immediate support, especially if you're in distress or having suicidal thoughts. We will list some general resources and encourage listeners to search for local ones. 4. Small steps can make a big difference. Lifestyle supports. While these are not substitutes for professional treatment, certain lifestyle factors can support overall mental well-being. Regular physical activity, even a short walk, can boost mood and reduce anxiety. Balanced diet. What we eat can impact how we feel. Adequate sleep. Prioritize good sleep hygiene. Mindfulness and relaxation techniques. Practices like meditation, deep breathing exercises, or yoga can help manage stress and anxiety. Social connection. Spending time with supportive people can combat feelings of isolation. Limit alcohol and substance use. These can often exacerbate symptoms of depression and anxiety. Remember, reaching out is a sign of strength, not weakness. It's an act of self-care and courage. There are effective treatments available, and people can and do recover and manage these conditions successfully. You don't have to go through this alone. We've covered a lot of ground today, delving into the often misunderstood worlds of depression and anxiety. We've learned that these are not just fleeting moods, but real, diagnosable conditions with a wide range of symptoms that can significantly impact a person's life. We've seen that, while sadness is a part of depression, it's so much more than that, often involving a loss of interest, changes in appetite and sleep, fatigue, and feelings of worthlessness. And we've understood that anxiety is more than just worry. It's an overwhelming and often physically distressing experience of fear and apprehension. Key takeaways from today. 1. Awareness is key. Recognizing the symptoms of depression and anxiety in yourself or others is the crucial first step. 2. You are not alone. These conditions are incredibly common and help is available. 3. Distinguish, but understand. Overlap. While depression and anxiety have distinct core features, they often coexist and share some symptoms. 4. Professional help works. Effective treatments, including therapy and sometimes medication, can make a profound difference. 5. Hope is real. Recovery and effective management are absolutely possible. People go on to live fulfilling lives even with these conditions. If anything we've discussed today resonates with you, or if you're concerned about someone you know, please take that next step. Talk to someone you trust, consult a healthcare professional, or reach out to one of the many support organizations available. This journey of understanding mental health is an ongoing one, and here at AI Mental Health Care, we're committed to being a supportive voice along the way. Our aim is to empower you with knowledge and inspire you to prioritize your mental well-being. Thank you for joining me on AI Mental Health Care. I hope this episode has shed some light and offered a sense of hope. If you found this episode helpful, please like it, subscribe to our channel for more insightful content, and hit that notification bell so you don't miss our future episodes. Your engagement helps us reach more people who might benefit from this information. We'd also love to hear from you. Share your thoughts or questions in the comments section below. What topics would you like us to cover in the future? Until next time, be kind to your mind and take care.